with 3 days remaining in most of the country to buy Affordable Care Act coverage for 2018, enrollment is running ahead of the same time last year but is almost sure to fall short in the end because of a compressed enrollment season. During each of the 6 weeks of this sign-up period, the number of consumers choosing plans through the federal healthcare.gov website has outmatched that of 2017, according to a federal enrollment snapshot released on Wednesday. And the overall sign-ups of nearly 4.7 million through last Saturday was about 650,000 higher than through the parallel week a year ago. If not for the pronouncements of its death, and steps taken to hobble it, the ACA marketplace would actually seem, well, alive, Larry Levitt, senior vice president of the Kaiser Family Foundation, tweeted in reference to repeated statements by President Trump and cuts in funding for efforts to encourage Americans to get insurance. A surge is expected in these last days before Friday's deadline in most states. The government will then automatically enroll perhaps 1 million to 2 million people based on last year's experience who have current ACA coverage but did not again sign up. Yet even the law's most ardent proponents are not expecting the ultimate tally to match the 9.2 million who got coverage last year in states using healthcare.gov during an enrollment season that went twice as long. 39 states are either in the federal insurance marketplace or rely on its computerized enrollment system. The deadline is later this month or in January in 9 of the states, including Maryland as well as the district, that run their own marketplaces under the ACA. On Tuesday, 2 senior Senate Democrats urged the Health and Human Services Department to extend the season to January 31 as in the past 3 years. The Obama administration had proposed shortening the enrollment period, at the request of health insurers, starting next fall. The Trump administration decided in the spring to make the change right away. The truncated sign-up poses further risks to the continued stability of the individual marketplace and puts the goal of affordable, comprehensive insurance for all further out of reach, Oregon Sen. Ron Wyden, the ranking Democrat on the Senate Finance Committee, and his counterpart on the Senate Health, Education, Labor and Pensions Committee, Sen. Patty Murray of Washington, wrote in a 3-page letter. They said the shorter time frame especially harms people with existing medical issues and lowers the odds of enrollment by healthy young adults, who tend to wait until the last minute. A spokesman for HHS's Centers for Medicare and Medicaid Services, speaking on the condition of anonymity since he did not have permission to discuss the letter, said officials continue to encourage people to make plan selections by that deadline so that their coverage can begin on January 1. Unlike the fall of 2013, when healthcare.gov debuted with serious computer defects that took months to overcome, enrollment this time has been comparatively smooth. But the site has been closed more often for maintenance 12 hours on all but one Sunday, and CMS officials said Tuesday that about 2 hours of unplanned downtime occurred on December